like to introduce our first speaker, Dr. Carmen Parter. Carmen is a Senior Research Fellow at the University of Queensland's Poche Centre for Indigenous Health. What Carmen will do, will share the findings of her Doctor of Philosophy study, especially in relation to systemic institutional racism. She will, however, go on to share a story demonstrating on how systemic institutional racism plays out in her personal and professional life. And importantly, she'll challenge us all as to what is required to tackle systemic racism.
Good muli nakanari Carmen galang Bugara. I just spoke in the Durumbo language. My dad's country essentially said, hello, my name is Carmen. Good afternoon. Thanks so much for the opportunity to speak at the Poche Indigenous Health Network Key Thinkers Forum on Racism and Health. As Tom alluded to, I'm at the Poche Centre for Indigenous Health at the University of Queensland. And today I want to present parts of my PhD with a particular focus on racism in the context of implementing our culture, now a determinant of health in public health policies. I've got my Twitter addresses there. Feel free to Twitter the session. And what I would like to argue today is that to heal country and our nation, we must talk about racism and similarly understand the impacts of systemic institutional racism in health. And this is a significant issue, particularly as we now have a new Closing the Gap national agreement that commits all levels of governments to transform their organisations and to address systemic daily racism and promote cultural safety. But before I begin, I just need to acknowledge the traditional custodians or owners of the lands that we're all meeting on today. I'm on the beautiful Bundjalung country, but also to just pay my respects to my ancestors and similarly recognise the valuable contribution that my forefathers have made in this regard. Who I am? I'm a proud descendant of the Durumbo and Druru clans of the Birragubba Nation in the state of Queensland. I also have South Sea Islander heritage from Tanna Island of the Republic of Vanuatu. I am one of 4 girls to May and Noel Parter, and May was a Yasso. And I also we also have a beautiful brother, Leroy, called Torres, who's been adopted through Torres Strait Islander culture. I play in this role of public policy because I want to make a contribution to making a difference for future generations, such as my grandchildren, so that they don't have to experience the things that I grew up with, and that they can enjoy the same quality of life that is enjoyed by all Australians. Today, what I would like to do is talk about my experience of racism. And as one of my research participants have said, we're the only ones who really inform policymakers, and we're the only ones who can tell people what our experiences of racism is. Importantly, just a reflection of this particular picture. This is my mum and I. We went, when I first started my Doctor of Philosophy back in 2016, I thought, Mum, come on, let's go down to the Historical Society. I need to gather some information about our family, which is a new area for Mum too, because unfortunately the knowledges and the culture wasn't really transferred down to her. And so we went down and I searched that whole building, and sadly to say that the stories of our mum's people and my people on the lands of the Duru country were invisible. And in fact, what was there was this tiny little wall. And there are lots of stories in that tiny little wall that, you know, I could delve into. But certainly what I walked away with when we visited the museum was our stories are certainly invisible and they need to be told. And so today I want to tell you some of those stories in relation to my PhD, but also in relation to experiences of racism. So just very quickly, when I undertook my Doctor of Philosophy, central to that was my indigeneity, my knowledges and my lived experiences, which is fundamental to when we're applying storytelling. And I'd like to acknowledge the policy actors who participated in a 50-minute yarning session back in 2018. And furthermore, I want to acknowledge how they entrusted me with their knowledges. And so this presentation is not the knowledges that I own, but they are the knowledges from the policy who gave me their thoughts and theories on what I'm about to speak about. Similarly, I'd like to acknowledge the National Health Leadership Forum, who was my reference group, and for the support and guidance and commitment that they gave towards the research project, as I do with Lowitja and the MK study. So thank you, Ray. And furthermore, the Sydney Poche Centre for Indigenous Health, because they sponsored me to do my Doctor of Philosophy after over 26 years being in government making policy around Aboriginal and Torres Strait Islander affairs. Just very quickly, in terms of my research, I was really interested around how policymakers implement culture once culture has been incorporated in a national instrument like the Aboriginal and Torres Strait Islander Health Plan. And more importantly, I really wanted to try and bring further meaning and understanding to culture. And that was prior to Ray's work actually identifying the cultural determinants of health, which I no doubt he will cover later shortly. But I used an Indigenous research methodology and in particular storytelling stories and yarning, and came up with 3 significant themes around policymakers must be able to have open heart and open mind and open ears to listen and learn, and must be prepared to walk alongside of Aboriginal and Torres Strait Islander people on a journey of discovery. And that more significantly, that when you're talking about our knowledge, you're actually talking about our culture, and that our culture actually counts in a public policy context. But today I really want to talk to you about addressing systemic and institutional racism and structural biases. And you'll find more about my findings in my thesis, Decolonising Public Health Policies, Rightfully Giving Effect to Aboriginal and Torres Strait Islander People's Knowledges and Cultures of Ways of Being, Knowing and Doing in Public Health Policies, held at the Sydney University. And in that, I also talk about a system-wide translational model of practice that applies concepts of system thinking. But today, I really just want to focus on racism. And I want to tell you a story about racism in action. This was an actual event that happened to me during the course of me completing my thesis and writing up my thesis, and I just couldn't help myself but tell it. So here it is, and it only happened last year. On the weekend, I was invited to a friend's birthday party that was attended mostly by non-Indigenous white people. I entered a very white space. My visible blackness got a stunning gaze when I entered the room of this beautiful mansion. For me, such a reaction is a sign that I was about to have some very interesting conversations. Anyway, I was approached by a tall, lanky Australian, and obviously a very privileged white person and white male who clearly was really interested in my heritage. On approaching, he asked, "Are you a native?" On hearing that question, I was stunned and shivered with silent disgust, shuddering as I proceeded to tell him of my Aboriginal and South Sea Islander heritage. So shocked that I couldn't even educate him about the inappropriateness of the term he just used. When reference was being made to a snake that was cohabitating on the grounds of the property where the party was being held, the conversation got worse and diminished into, "Do you eat snake?" "No, I personally don't eat snake," with a smiling assassin's expression on my face as I responded to that. So what just happened? This is racism, white privilege, and whiteness in action. As Morton Robinson writes, race matters in the lives of all peoples. For some people, it confers unearned privileges, and for others, it is the mark of inferiority. Whiteness does not relate to the colour of one's skin, and rather is about power, conquest, and authority over another, including structural dominance. Bargali, who reveals racism in the Australian public sector, explains her use of the term white. "When I use the term white, I am not referring to white people per se, but whiteness as a system of power relations that privileges non-Indigenous peoples over Indigenous Australians. Whiteness is socially constructed through identity and constantly reinforces the power of white identification and interest disguised as the natural, normal, and better way of being in the world." So I entered the room dominated by whiteness and immediately was labelled a native. The space in which I stood was possessed by the encroachment of patriarchal white privilege. When referred to as a native, I was placed in the position of being the inferior other. The nativeness was further confirmed when reference was made as to whether I ate snake. A set of deficit assumptions came with the native imagination. These assumptions insinuated that I am primitive, uncivilized, and on the lowest rung of the human race ladder. In fact, I'm not even human. I am also filthy, a drunk, and a lazy bugger who is uneducated and unemployed. Obviously, I am poor and probably live mostly on social security benefits with many other untoward blacks. These racialized stereotypes or typical assumptions I call the native assumptions. In my encounter at my friend's birthday party, the white patriarchal Noah asserted his white possessiveness and racialized superior knowledge over another. The above stereotypical native assumptions are based on colonialist and imperialist paradigms. They are the realities that Morton Robinson says are the effects of white possession underpinned by an excessive desire to invest in reproducing and reaffirming the nation's ownership, control, and domination of the other that is manifested in encounters like the one I described above. As I gathered myself from the onslaught of such racism, the conversation proceeded and I was asked, "What do you do?" And my response was, "I am a professor, a FIFO academic, working at the University of Sydney, doing a Doctor of Philosophy." What reaction did I get? An absolute stance of stunned mullet. That can't be right gaze. And why? Because there was no connection between my response and what the patriarchal white Noah imagined to be my reality. So what just happened? I was no longer a native. The white privileged patriarchal racialized Noah's knowledge had been challenged. Being a visibly black Aboriginal and South Sea Islander had diminished me to the status of a native, but that classification was no longer applicable. My experience of racism is a demonstration of the possessiveness of whiteness as espoused by Morton Robinson. I argue that these possessive white native assumptions of the inferior other play out in the making of policies. And these assumptions are inherent in the rules, norms, and behaviours of systems, organisations, and individuals. Morton Robinson similarly shares such a position. The nativeness of the native assumption have their undertones due to the legacy of colonisation that sustains inequity and inequality. These are the ingrained mindsets and beliefs that play out in systems and their subsystems like health, including health structures of operation. The native mindset is manifested in a way that excludes and marginalizes minority cultures, particularly around our knowledges and cultures of ways of being, knowing, and doing. The same attitudes embodied in the native assumptions were further revealed by Bagali's study that uncovers racism in the Australian public sector. And she writes in relation to their experiences, Indigenous employees experience racial microaggressions in every aspect of the Australian public service workforce. Racial microaggressions in the form of hostile, derogative and insulting behaviours, processes and practices are often invisible to non-Indigenous people because racism seems normal in a racist environment. I argue that the experiences and organisational behaviours described by Bagali and experienced by me in my racist encounters are endemic in policy making in Australia. It is therefore critical that organisational and systemic racialised behaviours at these institutional and system levels must be challenged. In closing, we must talk about racism to heal our country and to heal our nation. Thank you.
Thank you, Carmen, and a great presentation, and I must say on time as well. So well done on that one. We're going to go into a bit of a Q&A, and a reminder, folks, if you've got a question or a comment, please put them up in the Q&A box or the chat box up there, and we'll try and address them as we go along. Carmen, I think what I got out of there is a couple of points. One is about white privilege and about whiteness, and I think it's important that you did clarify that, because there's many different views about what whiteness is, but as you said, it's about a system of power rather than about a white person per se, and it's the sort of the background and the privilege that people have and that they bring to their knowledge base, which in fact does influence. And I guess the other point that that underlined what you were talking about was about unconscious bias and about how people do really develop up their thinking and their attitudes towards not only Aboriginal and Torres Strait Islander people, First Nations people, but to migrants and refugees and to low socioeconomic, and equally that we also develop assumptions about people and privilege, which may or may not be correct. So I think, and I'm sure we'll tease this out as we go along with some of the other presentations, the opportunity to look at the issue of unconscious bias. But this does really flow on to the health sector, and what Carmen wanted to do was to set the scene, and then we'll go into some of the specifics about the health sector. Was there anything you wanted to add to your presentation that you might not have said?
Yeah, I think I'd encourage people to refer to my thesis. There's much more detail in there, and it talks a bit more about my own experiences in the public sector as well, and how that plays out in public policy and programming design. And similarly, that there will be a further article coming out about this stuff.
Jim, we have a few questions. So we have a question from Bo Rambaldini. Is exclusion connected to systematic and institutionalized racism? And then we also have from Cara Turner. Hello, I am non-Indigenous and I love learning and supporting First Nations people. How can non-Indigenous people approach Indigenous people in asking questions to learn, but not appearing or coming across as being racist? And then we have a question, we don't have a name, but how do we deal with microaggressions in the workplace? In my experience, it has been very hard to address as I've been labelled difficult.
Yeah, they're quite big questions to respond to in such short time. But Look, in terms of being an ally, we need champions, because the complexity of our issues can't be solved by ourselves.
Yeah.
And so if you're a willing learner and are prepared to take a journey with us, then walk with us, learn to listen and understand that there's a whole worldview that will come to that teaching. And so to be open about that, but more significantly, take responsibility for your own learning too as well. Do your research, connecting with community, seek out a cultural mentor. In terms of Bose, I think it might have been something around exclusion. That is certainly a characteristic of those systemic institutional racism. And the best exclusion public policy that we've had in this country is the Australian Constitution, that not only introduced the white Australian policy, but excluded Aboriginal and Torres Strait Islander people to be counted in the Australian census, because we weren't even considered human enough to be counted in that census. So, you know, that's a subtlety that plays out in a way that our systems and organisations work. And in terms of microaggression, you know, it's really about looking after yourself and making sure you've got the support of your family, because working in these white institutions are really hard work. And in fact, maybe that's a recommendation, you know, for the public sector to seriously take the work of Bargelli and look at how they can mitigate some of the challenges that Aboriginal and Torres Strait Islander people face in public service. Thank you.
Yeah, thank you, Carmen. And I think what we'll hear a bit later on the presentation, and particularly from Karen on notice, you know, when we talk about the work that Reconciliation Australia does and the findings out of the barometer, and there's a fair bit of guidance there, and what some of the RAP organisations do to respond to some of these questions.